Myself, Dr. Mohammad Asif, consultant and interventional cardiologist from Olive Hospital, Mehedipatnam, Hyderabad. I welcome you all. So today I'll be discussing about a very important topic, that is pulmonary embolism. What is pulmonary embolism? You need to understand that the blood from the heart goes to the lungs, it gets oxygenated, again from the lungs the blood goes back to the heart, and the oxygenated blood supplies throughout the body. So the blood going from the heart to the lungs is through pulmonary artery. So any thrombus in pulmonary artery or a complete blockage of pulmonary artery due to thrombus, we call it as pulmonary embolism. That means there is no blood flow to the lungs from the heart, and there is no oxygenation of the blood from the lungs to the heart back again. So this is the leading, it can be a life-threatening complications many times. The pulmonary artery, there are two pulmonary arteries for the two lungs, right side and left side. Again, this pulmonary artery gets into a small branches. So if the blockages, if the thrombus, if it is in main pulmonary artery, this can become a very life-threatening and carries a very high mortality. So it becomes very important for us to recognize this problem and treat it immediately. Now in this COVID pandemic, we see many patients coming to us in emergency where they come with sudden onset breathlessness, okay, and when you record, the BP is on the lower side and the saturation is also on the lower side, SpO2. So this is the classical presentations of pulmonary embolism, and prior to that, either they will be having a history of long travel, or they have the history of any recent surgery or any immobilization or any DVT. So usually these are the things, when they present to this with a massive pulmonary embolism, they have a lot of complications and it can be sometimes a life-threatening. So how do we recognize pulmonary embolism? Some patients, they can present with only chest pain, but the most common symptom is breathlessness. They complain of severe breathlessness where they become very difficult for them to breathe, or they can have a stabbing kind of chest pain, or some patients, they can present with syncope also. So these are the various presentation of pulmonary embolism. Whenever you develop any of these symptoms, it is required immediately to meet your doctor or go to the emergency. And the most important test for the diagnosis of pulmonary embolism is CT pulmonary angiogram. So it will confirm the diagnosis in the CT scan if there is any thrombus in the pulmonary artery. If the thrombus is there, we have an injection emergency that needs to be given tenecteplase so that the thrombus can be opened completely. Otherwise, this can be a life-threatening and can have very high mortality. So my take-home message for pulmonary embolism is that this disease, especially in this COVID pandemic, we see very often. If any of the young patients develop sudden onset breathlessness, they have very difficult for breathing, and this is a fall in BP, don't ignore it. Immediately visit to the nearby hospital and work out for the pulmonary embolism, at least CT pulmonary angiogram, which will able to make a diagnosis early and we're able to treat it early. Thank you very much.